Hi, I'm Dr. Molly with Your Goals Physical Therapy. Are you tired of your herniated discs in your low back coming back every few months with a vengeance? And just you go several weeks without any back pain at all, and you think that you're finally over the hump, so you go try to run at the park. Nope, back pain comes right back. Then maybe you give it a couple months off, again, no pain for a really long time, so you're like, well, I'll go get a trainer and that trainer will help me. Nope. Make it through 2, maybe 3 weeks worth of training, and then you're just doing an incline on the treadmill, or you're doing some exercise that isn't supposed to be related to your back at all, and all of a sudden you have a huge back spasm. You can barely get out of bed for a week. If that's you, then you are not alone. In fact, somebody called me about 6 months ago with the exact same problem. Hazel was fed up. She had had enough of her lower back. She, over the years, so this happened like 10, 15 years ago, where she did something to her back and she got a huge back spasm and it just never really went away. And so eventually she went to the doctor, who did MRIs, and they discovered that she had herniated discs, but they weren't severe enough herniations so she didn't warrant surgery. They just basically sent her to physical therapy, which did great. She was like, I did fine therapy. I was able to do everything. I graduated, everything was good for a long time. But then when I went back to trying to do my own personal workouts and get back to my life, it seems like every time I do that, this back flares up and then I'm limited. And she's like, and I see the struggles that my mom's going through with back surgeries after back surgeries, and then her hips being done and all these things. And she's like, that's not the life that I want. I want to figure out what the problem is and fix it. I want to be able to go back to the gym, with COVID, and I'm hitting the age where we have menopause and I have all these other things going on. I don't want this to be one other thing. And I'm not really sure why it's not going away. I've tried massage, I've tried chiropractic, I've now tried physical therapy, and I just don't understand why this keeps coming back. So I talked to her for a pretty long time on the phone, and then when she came in for the evaluation, we were able to identify a few things that might have been like the missing piece. So if she's made it through therapy, we already know a lot of the things that work. So I was able to go through and try to figure out where it is and like what activities she wasn't able to get back to, and then watch how she's doing them. And then we came up with a plan to correct kind of the mechanisms that she was doing and that were causing her to have the problems. So we had to, go back over some of the core stuff, hip strengthening, just making sure that everything moved well. But I'm happy to say that after doing a deep dive into how she moves, a little bit of trial and error, we have been able to, one, eliminate the pain that she came in with. She hasn't had pain in a very long time. But we were also able to identify the exact thing that was causing her to have problems when she went back to the gym. So now here we are. It's been a couple months, but she's back with her trainer. She's on the path to getting her to achieving her fitness goals that she's been looking forward to for so long. And so I just wanted to give out that just uplifting message that even if you've been dealing with the pain and the dysfunction that comes from having herniated discs, even if that's been a long time, there is always a way to figure out what it is that is causing you to have reoccurring problems. If it was purely the herniated discs, like let's just take Hazel. So if it was purely just her herniated discs, those are always the same. Your discs don't change. So if you've herniated a disc or you have a disc bulge, that is just your anatomy. So if you have good days and you have bad days, then something is changing about those days that's making that a good day or a bad day. So then it just becomes the puzzle of figuring out what changes. So is it something that you're doing or not doing? Is it emotion? It could just be a lot of things. So that is the trick. The trick is figuring out what it is that's aggravating your muscles and your ligaments around your spine that's causing reoccurring pain over and over and over again. But there is always an answer for that. And it's just a matter of having patience and working through that with somebody. So if that's the type of care that you're looking for, please feel free to reach out to me. These are the puzzles that just make my day. I know that seems a little weird, but I really do enjoy helping people figure out what it is that's specifically going wrong with them and helping them get back to the things that they want to do. Not having pain but not being able to do anything is not necessarily the life everybody wants. So if you're looking to get back to running, going to the gym, kayaking, hiking, all of these amazing things that we can do in Houston and just a short drive away, then please feel free to call me. I hope that you're having a great day.